Good morning, everyone. My name is Davi. I'm a pediatric family nurse practitioner student at the University of Texas, El Paso. I want to present this time the case of a 19 years old African American female patient who came to the clinic this morning with her mother looking for a birth control prescription. She stated, "I have been in a monogamous relationship with my long-term boyfriend now, fiancé, and we started having sex, and I don't want to be pregnant. I'm planning to go to fall. I'm planning to go to college next fall." Patient report that she do not have a protective sex with her fiancé. So she do not want to be pregnant because she is not planning to have any baby now. She still have to go to college. Patient past medical history. NC report menstrual pain, history of allergic rhinitis, no hospitalization or surgery. Family history. Father is 42, history of obesity and diabetes type 2. Mother 40, history of depression. She have one brother who's 15 and he have a history of allergy rhinitis. Grandfather on her father's side is 80 years old. He have a history of CHF and kidney disease. Grandmother on the father's side died at 74. She has an earlier dementia and a Parkinson's disease. Grandfather on the mother's side is 77. He has COPD. And grandmother on mother's side, she's 75. She has a history of hypertension. Social history. Patient live with father, mother, and brother. She is a senior in a high school. Very athletic, play basketball. She denied using any drug or alcohol, never smoke. She is in a monogamous relationship with her fiancé. Diet. Patient report skipping breakfast most of the time and have a very balanced diet at home. Since her dad is diabetic, she avoid any food that can cause her insulin resistance. She avoids soda most of the time. She eat fast food once in a while. Sleeping, and she reports sleeping 4 to 6 hours a night, not because she has difficulty falling asleep, but because she is busy chatting with friends and doing her homework. Developmental, and she appear and act her stage 8. Review of system. Patient report no recent change of weight. She report some acne. She report acne on her face, chest, and upper back. Patient deny no headache, visual problem, or hearing problem. She deny any history of recent cold, sore throat, or tonsillitis. Patient deny any history of murmur, chest pain, or palpitation. She deny any recent bronchitis or cough or any respiratory problem. She deny any bowel problem as constipation or diarrhea. Patient deny any joint pain, swelling, scoliosis, or weakness. at this time. She denied any burning sensation when she urinating or any smelling or any concern with her intimacy. Her last menstrual period was 2 weeks ago. Actual medication are ibuprofen 400 mg. Patient is allergic to seafood. Her vaccination are up to date. Physical examination, vital sign, temperature 97.4, pulse 62, respiratory rate 16, blood pressure 120/76. Pulse ox 98%, on room air, weight, patient weight 55 kg, and her height is 172 centimeters. Based on the height and weight enter, the BMI is 18.6, placing the BMI for age at the 12th percentile for girl age of 19 years old. The patient has a healthy weight. Patient appear well developed, well nourished teenager in no apparent distress. Patient is alert, oriented, and to participant of the interview. The hair appear non-cephalic, achromatic, and straightful hair. Pupils single round and reactive to light. Extraocular muscular appear intact. No discharge, conjunctivitis, or icteral or scleral icterus. Nurse forces patient able to visualize Snellen chart with a 20/20 acuity. Positive red light valence. Ear appear with a clear external auditory canals, pinna normal in shape and contour. No preocular pits or skin tag. Tympanic membrane gray valare, no erythema or bulging. Nose normal pink mucosa, no discharge or blood visible. Normal midline septum. Mouth mucous membrane moist with wisdom teeth, no sign of caries or decay. Patient report that her last dental appointment was 3 months ago. In the pharynx is able to visualize tonsil, no swelling. Pharynx show no erythema or ulceration. Normal movement of soft palate. Neck grossly no swelling. No tracheal deviation. No decrease in range of motion. No lymphadenopathy, goiter or mass detected. Chest, Tanner 5 breast development, round chest cavity, no increase of accessory muscle, no evidence of increased work of breathing. Lungs are clear on auscultation by Lowry, no stridor, wheezing, crackle or raps. Good air movement. Cardiovascular quiet precordium, no right ventricular heaves or dural. PMI in left mid-clavicle line 6 intercostal space, regular rate and rhythm, normal S1 with normal split S2, no normal gallop or rap, +2 pulse in all 4 extremities including strong bilateral femoral pulse. Capital refill less than 3 seconds. abdomen soft, no tender, no distant bowel sign, present liver age palpable 1 centimeter below costal margin, but scratch test revealed normal liver size of 5 centimeter. No display, no megaly, no masses. Her extremities are warm, no clumping, cyanosis or edema, no gross deformity, good back straight, no lordosis, no kyphosis, symmetrical. A skin toggle with no tending, some open and close, come down on the face and forehead, scatera, pustule and erythemus, papules on forehead, cheeks, upper chest and upper back, no scarring or dyspigmentation. Patient have some moderate acne. Plan. Initial counseling. Contraceptive counseling was providing to the patient accurate information about all methods that patient is medically eligible for to help her choose which is best for her. This includes information about the efficacy, risk, and side effects, as well as advantages, disadvantages, and no contraceptive benefit of all methods that are available to her. Hormonal contraception was selected at the end of this. The reason hormonal contraception was selected because it will help with the acne and the dysmenorrhea that the patient suffer with. Before the prescription was handled, pregnancy test was done and was negative. Patient was not pregnant. Depo-Provera was the best choice for the patient, and mother agreed because of her busy schedule of school and extra activity that she is doing with her sport. The first dose that was given is 150 milligram IM. That one will be given every 3 months. Will start within 5 days of menses onset. So patient will be given the prescription to go buy the Depo-Provera and will come back 5 days after the menses onset so she can have her shot. And the follow-up will be in 3 months to evaluate how her body adapts with the contraceptives, with the medication. Patient education was given on the methoxy, progesterone, or Depo-Provera, with all the side effects and how it may affect the patient life and health. All those details was explained to the patient, and a brochure was given to her about the Depo-Provera. Some anticipatory guidance was given to the mother and the patient. For the mother was advised to support her child whenever she needed help. Patient was given anticipatory guidance on the use of tobacco, alcohol, and steroid. So patient was advised to avoid to avoid alcohol, drugs, and tobacco use, and manage conflict resolution in a constructive, non-violent manner. Make healthy food decision, eat nutritious meal and snack, limited sweet soda, high fat food. Engage in physical activity for 1 hour a day. She already very athletic. She is playing basketball in high school. No driving or riding in a car if use of alcohol, drug involved. Patient was given brochure on self-breast examination. Patient was handed the prescription of Depo-Provera and was given an appointment to come back 5 days after the onset of her menstruation to get the shot. Thank you very much.